I've been looking forward to this interview, Brian, because earlier this week we started hearing about this story. Canada's healthcare system, from the outside, may sound great. Universal coverage for all and for free. Well, it's not all it's cracked up to be. In fact, the new president of the Canadian Medical Association is saying that their system is, quote, imploding. And unless it is fixed soon, it will not be sustainable.
Dr. Anne Doig is the new president of the CMA, and she joins us right now from Canada to explain. Doctor, what's wrong with your system? What has to be added in for it to work?
What has to be added in is a focus on the patient and a focus on quality of care. So by that I mean the ability of our system to provide patients with access and to provide them with the care that they need at the time that they need it in a manner that is free of the impediments that may be extraneous to the decision about care.
Well, Dr. Doig, that sounds a heck of a lot like the American healthcare system, where people actually have freedom of choice to go and choose their own physicians and hopefully get the best care possible anywhere in the world. Are you saying that the Canadian system needs to be more like the American system?
No, I'm saying that both the Canadians and the Americans need to stop worrying about what each other's systems look like and look at systems elsewhere in the world that, quite frankly, are functioning much better than both the Canadian and the American system. We're so caught up in comparing each other to each other,
right,
that we have neglected to look at the deficiencies in each of our systems, and we have neglected to look at examples of care elsewhere in the world that are much more effective than what either the Canadian system or the American system is offering to its citizens.
Your main problem is the quality of care. What would increase, in your mind, the quality of care for the Canadian people?
The quality of care that we need is not quality in the sense of a good physician doing a good job. It is a question of being able to provide that in a timely manner and making sure that the interventions we do are appropriate and are able to be accessed by patients as they need them.
Can you give me an example of where the delay comes in?
Delays come at multiple levels in the system. We have, as you know, widely publicized issues with access to surgical procedures. So we have in Canada wait time guarantees and a desire to bring down the surgical wait times. We also have problems with primary care access, and that is sometimes due to an inequity in distribution, or it is due to simply the fact that there are not enough primary care practitioners to provide the service that people need at the doorway.
Right. Forgive me, Dr. Doig, forgive me for interrupting just for a minute.
To consultative service.
I hate to do the comparison again, but I have to, because Canada has universal health care, and that's what America is looking at doing. So I have to make the comparison, and the things that you're talking about, that you've been quoted as saying that Canada's going to implode. The healthcare system is going to implode. And the delays you're talking about, people are dying potentially. They're not getting the care that they deserve. They're waiting 6 months for some tests. In many cases, they're coming to America for those tests. And that's why America now is looking at your system, Dr. Doig, to see what may be coming down the pike for us.
Right. And there are elements of the Canadian system that are good. The element of universality is a good element. The element of the fact that people are not financially penalized for needing health care, that is excellent. Canadian doctors are in support of the concept that patients must not be limited from care because of the ability to pay. So the comparison is, how do we go about doing that? Do we look at a totally publicly funded system? Do we look at blended funding? Do we look at some combination of insurance that allows people to have freedom of choice, freedom of access, and at the same time, good, high-quality care?
Somebody right now, in the beginning of this segment, you said we got to look to other countries that seem to be doing a better job than the U.S. and Canada, two very different systems. Give us a couple of countries to look into, since we only have a few more, very short on time.
Well, as you know, our former president, our previous president, Dr. Ouellet, went overseas to some of the northern European countries, Belgium, France, the Netherlands, England. There are elements of each of those systems that are better than what we do in Canada.
Dr. Doig,
I don't know whether they're better than what you do.
Dr. Doig, where will Canada get the money to make your system better? Will it tax people more? Where will they get the money?
The question is not whether we need more money, but whether we can spend the money we are spending in a more effective way. And that's what I was talking about with quality and access to care.
Well, hopefully
spending money
listening
effectively to get appropriate care.
For the sake of the Canadian people. Dr. Ann Doig, this has been fantastic. Thanks so much for joining us.
Thank you.
It is fascinating because she was elected into that office. And so people must agree with her point of view there in Canada. A very fascinating interview.